Assalamu alaikum. I am here from Conceptual Medicos, and today in this topic we are going to talk about the ACE inhibitors, means the angiotensin converting enzymes inhibitors. First, we should recognize these that they have a common endings. They are known as prils, and some of the drugs involved in this are captopril, enalapril, lisinopril, ramipril, fosinopril, and enalapril. Okay, we should know about these drugs that they are the first line of drugs in the management of hypertension. Before going to the mechanism of action, first we should know about the physiology, then we will go to the pharmacology. So first, as we know that angiotensinogen is a protein which is formed in the liver. It is converted into angiotensin 1 by the enzyme known as renin, and this renin is formed in the kidneys by the JG cells, okay, in response to certain stimuli which will be discussed. This angiotensin 1 is converted into angiotensin 2 by the angiotensin converting enzyme. This enzyme is present in the vessels of the lungs which convert angiotensin 1 into angiotensin 2. Okay, now coming toward the function of the angiotensin 2. So angiotensin 2 perform many functions. The receptors of the angiotensin 2 are present on the blood vessels and on the adrenal glands. Okay, now the angiotensin 2 acts on the angiotensin 2 type 1 receptor. Here you should note the point that many students get confused in AT1. AT1 is not basically the angiotensin type 1 receptors, but it is actually the receptors for angiotensin 2, but it is type 1, so that's why it is angiotensin 1 receptor. Okay, so it is present on the blood vessels. It acts on the blood vessels. It is GQ coupled, and we know that the things which are GQ coupled inside the cell, this causes the increase of IP3 and DAG, which will cause the increase of the calcium ions inside and will cause the constriction of the smooth muscles of the vessels, which will lead to the vasoconstriction. So next, the angiotensin 2 type 1 receptors are present on the adrenal gland, which will cause the release of the aldosterone, and we know that the aldosterone is basically causes the sodium retention followed by the water retention, which will increase the volume of the fluid and which will cause increase in blood pressure. Besides that, the angiotensin 2 also causes cardiac hypertrophy and these changes. Now coming towards the mechanism of action of the angiotensin converting enzyme inhibitors. So basically the inhibition of the ACE causes decrease in the levels of the angiotensin 2. So we will reverse all the processes which were done by the angiotensin type 2, means there will be vasodilation because this enzyme is inhibited, the levels of the AG2 are decreased, vasodilation will occur, and due to vasodilation the total peripheral resistance will decrease, and this will cause a decrease in the blood pressure, which was our target. The second one is, as the receptors are also present on the adrenal gland, so there will be decrease in the aldosterone release. So when there is decrease, there will be decreased retention of sodium and water, there will be a decrease in the volume, and there will be decrease in the blood pressure. Okay, here I will mention a very important point, that angiotensin converting enzyme inhibitor also decreases the bradykinin metabolism, because the enzyme involved in the bradykinin metabolism is basically kininase, which is basically angiotensin converting enzyme. So by inhibiting the metabolism of the bradykinin, it will increase the level of bradykinin in the blood, which will cause vasodilation. Okay, now coming toward the pharmacokinetics. So don't go for the complex concepts, just know three things about the pharmacokinetics of ACE inhibitor. First of all, we give them orally, okay, except enalapril, which is given IV in hypertensive emergencies. Okay, they all are excreted through urine except fosinopril. Okay, now coming towards the adverse effects of the ACE inhibitors. So basically the first one is cough, and this is a very important point regarding the exams. And why this cough occurs, as we know that there is increased level of bradykinin because of the decrease in the bradykinin metabolism. This bradykinin causes cough by acting on the respiratory epithelium. The second most important one is angioedema. it is important to note here that angioedema occurs in very less, it is very rare. It is basically, in this disease, basically there is swelling of the lips, mouth, pharynx, larynx, etc. And this should be treated because it may block the respiratory passageway. The treatment include antihistamines and corticosteroids, and the patient should immediately stop the ACE inhibitors. The next one is proteinuria. It is important in diabetics, and we will discuss it later. Okay, the next one is teratogenic. It is contraindicated in pregnancy. Neutropenia may occur rarely, rashes may occur, and hyperkalemia may occur because aldosterone is decreased. And we know that in aldosterone basically causes aldosterone basically causes the secretion of the excretion of the potassium. So when aldosterone is decreased, there will be retention of potassium and leading to hyperkalemia. Here I will discuss a very important point, that ACE inhibitors are contraindicated in the patient with bilateral renal stenosis. First of all, coming towards the physiology, let's suppose this is the kidney. Let's suppose this is the glomerulus, this is the afferent arteriole, and this is the efferent arteriole. We know that the diameter of the afferent arteriole is greater than the diameter of the efferent arteriole, and we know that there are receptors for the angiotensin 2 on the efferent arteriole, which basically causes vasoconstriction in certain condition and regulate GFR. Okay. Now, if a person has renal arterial stenosis, so there will be less blood flow to the kidneys, and this less blood flow to the kidneys, so the GFR here is compensated by the vasoconstriction of this efferent arteriole. So it vasoconstrict and causes the blood to pool here and increases GFR. So it maintains GFR at a normal level. Okay. Now when you give an ACE inhibitor to such patient, then this angiotensin 2 level will be decreased, and these compensative vasoconstriction will not occur, leading to decrease in GFR and leading to renal failure. Coming towards the drug interactions, so ACE should not be given with potassium sparing diuretics. Because it will also spare the potassium, and due to decrease in the level of aldosterone due to ACE inhibitors, it will also cause increase in the potassium in the blood, so it may lead to dangerous levels of hyperkalemia. ACE should not be given with lithium. Lithium is basically a drug which is used in bipolar disorder, so it should not be used in this condition because it will cause decreased excretion of the lithium and leads to the lithium toxicity. It should not be given with NSAIDs, because as we know that with NSAIDs there is decreased decrease the level of causes water retention, and it will oppose the action of ACE. It should not be given. It should also not be given with the thiazide, because diuretics increases the antihypertensive effect of ACE inhibitors. Now the uses, we have discussed that it should be used in hypertension. For all grades of hypertension, it should be used in acute MI and should be started within 24 hours in patient with myocardial infarction. It should be used in diabetic nephropathy, and it is a very important point. It needs some explanation. As we know that in diabetic patient there is vasculopathy and there is decreased blood flow through the kidneys. The blood flow is diminished, so ACE will cause vasodilation of the efferent arterioles. Okay, when the efferent arterioles get dilated, then there will be decreased intraglomerular pressure. Okay, there will be decreased intraglomerular pressure, there will be decreased GFR and decreased proteinuria. Okay, it is also used in scleroderma renal crisis. Basically, scleroderma is an autoimmune disease which basically target the extracellular matrix and the things in the connective tissues, and it leads to the acute renal failure, which leads to the hypertension. So these drugs is given in such conditions. Thank you.